I did my project on exercise during pregnancy. Why is it important to understand the effects of exercise during pregnancy? We want to know the safety for the mother and make sure that the developing baby is also safe. Exercise requires a significant amount of work done, specifically at a vigorous level, 6 to 9 METs. And a MET is a metabolic equivalent of a task, which is the amount of energy you burn. And so most pregnant women are recommended to stay below 6 METs. So it's important to know the risks and the benefits and all of that good stuff to make sure that everyone is safe. Okay, I wanted to start off with a breakdown of the stages of pregnancy. So we have 3 trimesters. The first trimester ranging from 0 to 13 weeks, where the fetus's body structure and organ system is forming. Second trimester from 14 to 26 weeks generally is characterized by the accumulation of fat and the first movements of the fetus. And then the third trimester from 27 weeks to 40 weeks is characterized by the fetus growing larger and the organs fully developing. There are some main anatomical changes that occur during pregnancy. The first of these being the space in the body cavity throughout pregnancy is going to change. In the first trimester, the uterus is contained in the pelvic cavity, but the second and third trimester, it expands into the abdominal cavity, pushing the viscera, the internal organs, upward into the thoracic cavity. We're also going to have abdominal muscle separation because they need to lengthen and stretch during pregnancy to accommodate for the expanding uterus and support for the body. And then finally, we're going to have a forward shift of the center of gravity during pregnancy, which can lead to imbalance and risk of falls, especially during exercise. So first, I wanted to go over the nutrient need and usage. Number one, magnesium is super important during pregnancy because it helps to decrease hypertension that may be caused by exercise. Hypertension is high blood pressure, and the magnesium helps to regulate that blood pressure, keeping it down, making sure that it doesn't go too high and have negative effects on the fetus. Next, glucose is super important. It's the main sugar found in the blood, and exercise actually decreases the likelihood of developing gestational diabetes mellitus, which is considered any degree of abnormal glucose tolerance detected during pregnancy. So, what happens during pregnancy is that the second and third trimester glucose is reserved for the fetus, but when we exercise, we need to take in some of that glucose, and so exercise promotes the skeletal muscle cells to increase the uptake of glucose and conversion and balance and insulin secretion, which will all help reduce blood glucose level. Then we have sodium. During exercise, pregnant athletes experience greater fluid loss than non-pregnant athletes, which is due to greater cardiac output, increased blood volume, and reduced vascular resistance. And with more fluid loss, there's also going to be a greater amount of sodium lost. So the sodium intake for pregnant women needs to be higher than women who are not pregnant. Also, during pregnancy, the total amount of electrolytes in the body and the amount of water in the body is higher to make sure that everything stays in balance, the communication is solid. So when there's more salt lost, there needs to be even more salt, more sodium brought back in to maintain those balances. And then lastly, lipids. These have been studied and are known to become one of the main sources of fuel during the second and third trimester of pregnancy because while the breakdown of this process, lipolysis, is complicated. The mother's body can do that and reserve the easier process of glycolysis, breaking down glucose for the fetus to get the nutrients and energy that it needs, since glycolysis is a simpler process. Okay, so next we're going to go over the changes in the blood. So first, blood pressure. During pregnancy, cardiac output increases up to 45%, and the heart rate baseline level is going to increase by up to 25%. This can lead to the development of preeclampsia, which is extremely dangerous for the fetus because it increases the risk of placental abruption. And so exercise is extremely important because it decreases the blood glucose level, which is safer than trying to control that blood glucose level with medication. However, intense exercise can be dangerous because resting cardiac output is increased in pregnancy. So the maximal cardiac output induced by exercise, which is going to be achieved at a lower level of work. So being careful not to overdo the amount of exercise to try and prevent preeclampsia, at the same time making sure that you don't cause other problems by exercising too intensely. And so high intensity exercise is often considered not safe for pregnant women because blood flow to the uterus ends up being redistributed instead to large muscle groups that are putting in work and needing more oxygen. And this is detrimental to the fetus because it can cause fetal bradycardia, or the slowing down of the heart in the fetus. We're also going to see a change in the hemoglobin concentration. It's going to be a decrease. And hemoglobin is used to carry oxygen throughout the body. So a decreased amount of hemoglobin means that less oxygen is getting to the muscle cells. Hemoglobin concentration falls because there's an increase in plasma volume in pregnant women. So while exercising, a decreased concentration of hemoglobin in the blood means that the heart rate needs to pump harder to get the oxygen to the cells. If the heart rate's pumping harder, then the cardiac output is increasing and the heart rate is increasing, and all of these things that could lead to preeclampsia. So there's a fine balance in the blood that needs to be very, very specifically regulated and carefully monitored to incorporate exercise into the time of pregnancy. Okay, next we're going to go over temperature regulation. So, there's a critical threshold of maternal core body temperature at 39 degrees Celsius. So, anything higher than that causes hyperthermia, which is a increase in above the normal core body temperature. And maternal heat stress from exercise or other causes can reduce placental blood flow, causing dehydration and triggering inflammatory responses and leading to preterm birth. So maternal heat stress is really, really bad for the fetus. And prolonged reduced uteroplacental blood flow, so meaning not a whole lot of blood is getting to the uterus for extended periods of time, can result in fetal growth restriction and low blood weight, if not worse. Things such as in the first trimester, organogenesis stage is particularly sensitive to heat, which can cause potentially defects in neural tube development. So, a pretty serious problem if there is too high of a heat. So, how does the female body deal with that? The pregnant women have been found to have lower core body temperature, an increase in sweat production, increase in blood volume, increase in skin blood flow and skin temperature, and have an increase in thermal heat capacity due to the elevated body mass that they take on. So, pulmonary adaptations. The main changes are the rib cage geometry is different, as you can see in the diagram. The angle from the xiphoid process on the sternum is going to be significantly increased as the uterus expands during pregnancy. And this doesn't cause a change in the volume of the lungs, but it occurs because of both the physical baby pushing organs up and chemical factors such as hormones. The diaphragm thickness also does not change, but because the diaphragm is connected to the now expanded ribs, it cannot do as well of a job creating a pressure gradient because it's stretched out, which is why the abdominal muscles and intercostal muscles become more engaged for inspiration during pregnancy. What are the problems for exercise? So there's going to be a reduction of functional residual capacity because of diaphragm elevation, causing a residual volume decrease, making breathing harder, and there's going to be an elevation of respiratory resistance and a decline in respiratory conductance. So while exercising, the demand for oxygen shoots up drastically because of many factors. So that's why even everyday tasks like climbing the stairs causes shortness of breath in pregnant women. And the oxygen consumption is already increased due to maternal and fetal metabolic needs. So therefore, the tidal volume on a day-to-day basis is actually going to need to increase by 30 to 35%. Okay. Lastly, I wanted to go over the hormone relaxin. Relaxin is a peptide hormone that mediates renal and systemic hemodynamic adaptations during pregnancy, and its levels peak at the end of the first trimester in humans, which you can see on this graph on the slide. Relaxin helps to vasodilate blood vessels so that blood flow to the fetus is not restricted. But relaxin has another role to induce collagen loss, which leads to relaxation of ligaments and cartilage. This is helpful for the pregnant woman's body to be loose and flexible for adaptations needed during pregnancy and birth. However, when exercising, the mother is at risk of increased injury due to the ligaments being so loose. So, while the pregnant mother will be more flexible, she also might end up hurting herself if she is exercising too vigorously and isn't careful with her body movements. So, from all of this, why is exercise so important? It's going to lead to an easier pregnancy. There's going to be less weight gain and a beneficial effect on urinary incontinence. There's going to be less lumbopelvic pain because there's more support from the muscles. And there's going to be lower risks in pregnancy in general. The pregnant woman will also have an easier birthing experience. Training of the diaphragm and the abdominal muscles will all help during labor to actually decrease the amount of time needed. And there is a less likelihood for cesarean delivery when a woman has exercised throughout her pregnancy. And lastly, there's the fetus that's born is just going to be overall stronger and healthier. Exercise prevents macrosomia, which is growing too large, the fetus growing too large prior to birth. And exercise also increases the gestational age at delivery and decreases the risk of prematurity. So the fetus is more likely to remain inside for a long period of time before labor starts, and the fetus will be born with plenty of nutrients and fully developed organs to survive. And these are my references.